Everyone, welcome to our second workshop, which we've called Engagement, Participation and Co-production with Parent Carers. But the key bit is the development of our Bristol Community of Groups, and the workshop element of this is going to be around communicating with parent carers. So we're hoping very much, Steph and I, that you will take part in the main bit of it, really, which is around identifying the challenges and some of the solutions that you might have tried in your area, that we can so that at the end of the workshop we can all perhaps take something away and think, actually, that would be helpful to try in our area to improve that kind of wider communication piece. So I'll let Steph introduce herself.
There you go. Hi everyone, my name's Steph Lynch. I work for Bristol City Council and I'm the SEND Parent Carer Co-production and Engagement Lead.
Lovely, thanks Steph. And Joe, do you want to just introduce yourself? Sorry, I didn't do that at the last workshop, did I?
No, that's absolutely fine. Thank you. Hello everybody, I'm Joanna Carr and I work at the Council for Disabled Children. I'm just going to do the tech support and facilitation this morning.
That's lovely. Thanks, Joe. It's really appreciated. So I'm going to start by just giving a little bit of background and context, not too much. Steph's going to talk to you about what's a fairly innovative community of groups in Bristol. And as I say, finally, hopefully we can work together around the challenges that we've got around communicating with the wider kind of parent carer body, and examples from yourselves of successful communication with parent carers. I did start the last workshop by saying it is a little bit ironic, isn't it, that we talk about communication being a problem when it, in our everyday lives, it's very, very easy and very quick with our, phones and laptops and all the rest of it. So it's something that is there to be solved, I think. And we continue to struggle to communicate with our parent carers adequately, I think. But a bit more about that later. First and foremost, I'll just tell you very quickly about Bristol, North Somerset and South Gloss Integrated Care Board, or Integrated Care System actually as well. So we've got about 1 million people. We've got one integrated care system, 3 local authority areas, and it's split into 6 localities. As I said, if you were here earlier in the day, it's a relatively wealthy area, but significant areas of deprivation, and you can see that in the bottom left-hand corner, the kind of relative variations. And there's a significant difference between the 3 local authority areas as well. So we've got the City of Bristol, which has an average age of 30, and a 10-year difference in life expectancy from a man in a least deprived area to one in the most deprived area of Bristol, and something like 120 languages spoken across the city. So very, very diverse. Our other 2 local authority areas, North Somerset and South Gloucestershire, and Bristol's like the meat in the sandwich between those 2. Very different. The average age is nearer 43. And for a woman living in those 2 areas, the difference in life expectancy is about 8 years between the most deprived and the least deprived areas, and way less number of languages spoken in those 2 areas. So that gives you a flavour of our kind of area that we live in. We've got 3 parent carer forums, and they're in various stages of development. South Gloucestershire is a well-established, mature organisation. North Somerset was in turmoil about 5 years ago, but that's been turned around and now is in a rapidly maturing organisation. In Bristol, there's an element of challenge at the moment, and it was also recognised in the last SEND review in Bristol, but also the SEND re-inspection that followed that as well, where the relationships with parent carers was identified as an area of significant weakness. So we're very much focused on that at the moment, and it's the subject of our accelerated progress plan. Bristol local area has a parent carer forum, but it's not supported by the local area at the moment. And we are working through the kind of implications of that and how we can kind of move that piece forward. So we had to look at a way of how we were going to engage with parent carer groups across the city in a slightly different way in the interim, and maybe for the longer term as well. So I'm going to hand over to Steph, who's going to describe kind of what happened and how we've moved from a point where we didn't really have any kind of engagement groups to where we are now. Thanks, Steph.
Thank you, Mark. Hello, everybody. Yeah, I'm just going to take 5 minutes to just talk to you a little bit about, as Mark said, it's an informal network that we've developed that's now been running a year. And originally, so I came on board and this was a new role at Bristol that was created really to try to address this area of weakness that we had after our last inspection. And again, as Mark's alluded to in his description of Bristol as a city, you know, we've got a really diverse city. We've got you know, a large Somali community, Polish, large number of people who speak Arabic as their first language. And when I came on board, one of the things I wanted to do was try and find a way that we could represent that diversity better. Another thing I wanted to try and improve is the way we coordinated our activity and the finding better ways of engaging communities rather than maybe health, education and social care, you know, try to do their co-production activities separately, and perhaps people reaching out to the same groups at the same time as another group team was reaching out to them, and groups and parents getting survey fatigue. So try to bring in a bit of coordination to our activity, try to expand our reach to that more diverse city. So I started reaching out to different groups, and it sort of snowballed in a way, saying, you know, we'd like to get these meetings going where we all come together, Bristol people and community groups. So we haven't just limited it in Bristol to parent carer groups or to SEND groups. We've opened it up to community groups as well, because there's that recognition that somebody from the Somali community may prefer to approach, say, the Somali Resource Centre or Bristol Black Carers, or, you know, rather than go to a specific SEND group. So we're doing that as a way to reach families that we perhaps hadn't heard from before. So as I say, it's a community of groups, not just SEND groups. And we've had a year's worth of meetings now. All the meetings are really well attended. One of the things that the groups have reported back after a year's worth of meetings was they really appreciate the fact that this senior leaders from Bristol attend, and they regularly attend, and they've got used to seeing the same faces, and they've really valued that. They've also really valued the opportunity to network between themselves and get to know the groups in the city. And before and after I book a room, I always have an hour either side for networking opportunities so groups can stay behind and meet and you know, use that time as they want. So when we initially started to meet, the very first meeting we had, we just got everybody to introduce themselves and basically went around the room. If you had a magic wand, what issue would you resolve for your community or the people you're trying to represent? And we sort of used that to try and create some task and finish work. So we said, okay, they're the issues you've raised, you know, tested the appetite for the people who are in the room to come and work with us on any of those particular issues. And you know, we've got some really good work produced as a result of that. So the autism lead that was at the first meeting, you know, had a meeting with the Somali community, and they've now translated all the autism training materials into Somali, and that first training is going ahead, I think, this month or next month. So, I mean, there's lots of other projects that I could talk to you about that have come out of that first and then ongoing meetings. So what, you know, it is an informal network, and I think the challenge for me now is to try and start to almost hand over the reins on that and have it a bit more parent led than leading it myself. I do try and arrange agendas around feedback that I've got from groups from these issues that they've raised, ask who they want to come along from the council. So we've been able to develop a community group and Bristol City Council joint response to the Green Paper, for instance. Our accelerated progress plan, we've worked on that together with all the groups. So, you know, it's been great to be able to engage with those groups. And like I say, and great to have that senior leadership buy-in, I think, from Bristol as well. So, yeah, I think, if you feel there's anything important I've missed, I don't think.
No. Okay. Thanks, Steph.
Okay.
So yeah, so the community of groups has been terrific bringing groups together, actually, and as I've been kind of part of seeing it develop, I've been thinking that a good model for an area might be the Parent Carer Forum as the kind of overarching body, and then with a community of groups underneath it in a local area as a way of promoting that kind of wider engagement. But you know, a couple of things that we've come across already is that to keep groups interested and attending, you've really got to put some time and effort into that. To get new groups involved, you've got to put some time and effort into that, that's for sure. And the whole bit of communicating with, you know, the widest possible group of the whole group of parent carers in an area is very, very difficult indeed. And one thing that I did notice is that part of my job, I end up looking at complaints essentially, and kind of really unpicking them and finding out what the issues are. And what I've noticed is that in virtually every complaint, communication is one of the root causes of the problem. It's not the only problem, but it's often one of the main difficulties that parent carers are saying that they're struggling with. And we've got 3 local offer websites in our 3 different local areas. So in theory, all the information's in one place, but when you talk to parent carers in our area, often they say they don't know the local offer exists. And the ones that can find it, and it's around, when we do surveys, it's around 40 to 50% know it exists. They often say it's difficult to navigate, it's too complicated, and they gave up, basically. That's the message we get quite often. Which to me, in the kind of technological age that we live in, is something that we should be able to do so much better, but we don't seem to be able to. But more about that when we come to chat in the workshop. But even where we work closely with parent carer forums and other organisations, you know, we've still got that communication problem, and it seems to be recurrent. So that's why we decided to have it as the theme of the workshop. So although we've got the community of groups in Bristol and we've got our parent carer forums in the other 2 areas, it's not perfect. We know that. We know we can do things in much, much better for a start. But it would be helpful to get the benefit of ideas from other areas. And hopefully at the end of the workshop, you'll be able to take something away and think, oh, actually, yeah, that's something perhaps we could try in our area. So if you could have first and foremost, Joe's agreed to take bullet point notes for our discussion. So nobody needs to take any notes apart from Joe. Thanks, Joe, for offering to do that. So what we thought was that we'll drop the presentation off in a moment so that we can see everybody and be as face-to-face as we possibly can. What we thought, Steph and I thought, was if we had about 5 minutes or so just on the challenges of communicating with the wider group of parents and kind of note those, and then perhaps the 10-15 minutes about some of the ways that you've tried to address those challenges in your local areas. So if we can probably lose the presentation now, Joe, if that's okay. Thank you. Thanks. So would anybody like to kick us off of what the challenges they've found in your particular area? I mean, I've been through ours, basically. We've got 3 very different areas, and there are 3 different ways of kind of communicating with parent carers in the 3 different areas. But I don't know what the percentage of parent carers is that we reach, but I don't think it would be that high a percentage, actually, if you could actually get that data together. So would anybody like to kick us off about the challenges that they're facing in their area? Is there anybody there, in fact? I can't see anybody except Steph.
All must be working perfectly everywhere else. Maybe.
Oh, here's Louise. Oh, and Clive.
Oh,
Yeah.
hello. I think one challenge is, and you mentioned this, it's about relationships between the official parent carer forum in the area and the groups beneath it. And if there is tension in that relationship, that's quite a difficult one, because ideally you want the parent carer forum to be the conduit, to be a key conduit, but if that doesn't work effectively, then you have lots of people, then lots of different conversations going on, and it becomes more fragmented.
Yeah, no, absolutely agree with you. And you know, when you look at the way that parent carer forums are funded as well, they get their 17,500 from Contact if they're supported by the local authority, and as most are. But then the funding, you know, I can only talk from what we do in our area. So we give a certain amount to each of our 3 parent carer forums as what we describe as core funding, and then commission them to do separate pieces of work. And it's something we're working through at the moment. It's not equitable across our area because it's just developed historically through 3 separate areas, and we've now joined together. So we're trying to kind of unpick that and piece it back together again. But if we really want them to be that kind of single conduit that works as a professional organisation, then we've got to fund them accordingly, I think. And somebody said in the last workshop that the difficulty is we tend to fund them year on year, so they've got no sustainability, and so they can't kind of plan and get a core group of staff that they can, you know, work forward with. And they're always kind of hand to mouth. So we're asking them to do an almost impossible task. So I think one of our challenges is to make sure we've got the right amount of investment and commitment to those groups to be able to, for them to be able to provide what we want them to provide, because we ask an awful lot of them, actually. And I'm sure you do in your areas, because the law demands it almost, doesn't it? The SEND Code of Practice demands it, quite rightly. And especially the new SEND inspection framework, you know, is all about experience and outcomes, isn't it? So, you know, we're going to rely on them more and more, and which is exactly how it should be. But we're almost asking the impossible of them at the moment, I think. Yeah. Sorry, I interrupted. Somebody else was going to speak then. Was it Tara or Clive? Sorry, I didn't see who it was. No. Does anybody else want to tell? Oh, Clive. Yeah, it was.
I was going to say, yeah. I mean, I think I've got similar challenges to the above, in the sense that, again, it's the level of commitment that we're kind of expecting from parents who, at the end of the day, are volunteers and doing this in their own time, and the kind of sense of what is the offer from services to them to actually want to give us their views. And likewise, the kind of, again, the tensions between, because again, Lancashire is a very large authority, between the fact we're probably three authorities. We've got a similar sort of footprint itself, like 1.2 million people.
Yes.
So, but we are probably more inclined to be working on one footprint, and we've now got an ICB which has a slightly bigger footprint, because it also covers South Cumbria as well. But it is that challenge of kind of sustainability, or a sense of awareness from people who are inspecting us that have kind of actually sustainability is not guaranteed on the box, is it?
No, absolutely not. No, I mean, the analogy I use with, you know, I've talked to our parent carers about this, is that it feels like they've been an organisation a bit like what in schools the parent teacher association, kind of in a school of volunteers who organise this, that, and the other, and we're asking them to move to be a much more professional organisation to be able to give us the kind of data and information that we're requiring, but we're not actually providing them with the kind of wherewithal to make that move, I don't think. But it's, you know, we're living in a situation as well where those resources are not around really to invest either. So, you know, I know it's about priorities at the end of the day, and I think we do need to prioritize. It's my personal view, but you know, that doesn't always land in the right way in organisations. Tara.
Well then, thank you. I'm a DCO who works across 2 local areas, and also that means working with 2 parent care forums, and they are both you know, very active groups, and you know, they are very much proactive in terms of wanting to work with colleagues across the system, partners across the system. I suppose the only concern I have, especially with the new SEND inspection framework, looking at that impact and being very much about how does it make a difference in the life of an individual child and young person with SEND and their family, is that it's not always going to be the parent, it's not always going to be representation or membership of the parent care forum that's going to be part of those discussions. And so for me, what I tend to find is that whilst we have very active, very good representation from our parent care forums, you do tend to see that they are more those parents and carers that are, you know, have had a lot of complexity, a lot of challenge, especially across the system. And for me, there is a whole, you know, widespread cohort of parents that are probably more, who have probably found actually being, if they've tried to engage with parent care forum, that it's been quite intimidating for them because they probably felt my child's nowhere near the level of intensity of theirs, but still have their own challenges. So I'm thinking of, you know, those families where their child has moderate learning disabilities or developmental language difficulties, no specific neurodiversity diagnosis or complex medical or physical disability. We still need to capture whether this is working for them. And I suppose for me, it's a, you know, when we look at anything we need families, you know, parent carer involvement, you know, co-production with, for me, I'm really quite keen as well to, yes, we need to get the parent carer forum on board, but how can we work with the parent carer forum or, you know, colleagues across the system to actually bring in some of those families that voice doesn't necessarily get heard. So yeah, I'm always really interested in you know, where other areas have found that challenge and how they've addressed that. So if there's sort of anything you want to feedback on that, that would be absolutely great for me.
Yeah, I think that's the, to be honest, Tara, that's the crux of the issue actually, is how we do that wider engagement. I don't think we've solved it by any stretch of the imagination. I think we're getting better at it. And we try all sorts of different things. You know, we've tried going to coffee mornings, we've tried going to all sorts of different things actually, and they all work in their own little way. But to actually achieve that kind of wider success is difficult to sustain, I think, is how I describe it at the moment. How do you find your local offer works? Sorry, I'm asking you a direct question there, Tara. Sorry, that was to
No,
everybody actually, but yeah, thank you.
I mean, at the moment, one area is taking it in-house, so it's been with an external website host, and now they're bringing it in-house. I do think, you know, I always like to test out other areas as well. So like if I've got something, you know, maybe a child or a family moving into another area or whatever, I'll sort of test that other area's local offer myself as well. I don't, you know, so and I always, you know, I think it's still a work in progress. I think local offers across both of my local areas, and I'm sure most people will say the same. I mean, there is some work currently. The Hull Parent Carer Forum asked myself and the assistant DCO to work with them on and the local offer lead officer around, I think we talked earlier about that navigation issue people have with local offers, and actually one of the biggest frustration for families is that bounce around. So it's when a professional signposts them towards another service thinking that that service does whatever, and they go to that service and they say, well, no, but actually try that, and they find that they're bounced around, which we know happens. But I think more importantly, they were saying if they could have something on the local offer that was really clear, almost like a quick reference guide that was really clear on what a service does provide and what it can't provide, then they said that hopefully would have a two-way effect in terms of, as a parent, they could see, oh yeah, you've sent me, you know, they're advising me to go there, but I've looked on the local offer quick reference guide and actually they aren't going to meet my need. And they could even do that in consultations using their own phones. Or it actually, hopefully over time, will make professionals more knowledgeable in what is best to be signposting people to, if it's not within their gift to provide support or service. So we're looking at that at the moment, just because, like I say, that bounce around, I think, is one of the biggest frustrations that families feel, you know, when trying to get the right information from the right person.
Yeah. I mean, I imagine we've all experienced it in various stages of life, being on the phone to somebody, they'll go, oh no, you need to go and I'll just direct you, and you get cut off and all the rest of it. So yes, appreciate those frustrations for families, they're enormous. Yeah. What's the local offer like in your area, Clive? Is it helpful?
If I'm being honest, it probably reflects what your thoughts earlier. Yeah. Like not we have parents who say, where is it? What is it? Oh right, oh. Things like newsletters, like, oh right, oh have you got one? Oh right, okay. So that we're not promoting the making people aware they exist well enough. And then the actual content isn't I mean, in my head, isn't accessible. It certainly isn't accessible in terms of kind of different cohorts of people. Yeah. Sometimes too many words. Sometimes ill thought out information on it, and so yeah, I can understand parents. And one of the things which I'm trying to kind of push locally is the need to kind of train people who are the kind of intermediaries to use the website, because in some ways, again, if you don't train people, for instance, in libraries to kind of be able to facilitate access, then they kind of have a signpost to people who can actually kind of just help people to just have a navigation session.
Oh, I see.
But St Helens Council look like that's one of their strategies, which feels like the appropriate one. But I'm struggling to convince my local comms group that is a fairly obvious strategy to employ.
Yes, yeah, that's interesting. It's Carol with a hand up. Hi.
Hi there. I actually coordinate the local offer in Wandsworth, and just following on what Clive was saying there, I've been in this role for about 18 months, 2 years, and actually the whole thrust of what I've been doing is exactly what you were just saying, is actually going out literally on a roadshow, going to schools, Senko forums, things like that, actually explaining to people what the Send local offer is and where you can find it, and that it's all the information you need in one place. And that's very much what I focus a lot on our things. That's the one side that we focused on. I have a small little cardboard folded leaflet, which goes everywhere. And we've got thousands of copies out in the wild. They're made out of paper, so hopefully they do go back into being recycled. Using QR codes. We know that a lot of our users on our local offer website use mobiles, making sure our stuff is mobile friendly. And also when I took over, I think when local offer website started, everybody seemed to think that more was more, and I came to the conclusion that actually less is more. So I'd realised that the website had mushroomed, and I've spent a long time culling it down, which I think is another thing about accessibility. You don't want too many things on there. You want to find what's relevant in your area easily, as much as you can. And of course, the other thing is you're only as good as the information you get given. So when you talk about clarity of what's there, if you don't know a service, although I can, and I do liaise with all our contributors, it's a very big job. And ours sits within a family information service website anyway. So there's so many logistics. I actually don't think people understand how much logistics and time goes into keeping something like that, which is very crucial, but keeping it running in a way that works and is easily accessible. And we've been feeding with our parent carer forum about particular subjects. I've been doing that kind of saying they had an issue, say, with our pages around school transport. They couldn't understand the information from it, so we went and met them, and we got the people from the department, then we went and redesigned our pages. So there are quick wins, but it's a long job. But I think you have to be committed to it. I mean, I think that's what I realised, and it's definitely about promoting. You can have great things in your local offer, but if people don't know where to find out about them, they don't know you've got a good local offer. They don't know what services you've got. You're absolutely right. But I do believe it's actually, especially post-COVID, it's getting out there into the communities, posters, cards, being at events, like you were saying before, community events, not just schools, wherever you can.
Yeah.
So that's what I'm doing, but I'm here to hear what everybody else is doing as well, because all the tips you can get is great.
Yeah, that's great. Thanks, Carol. So yeah, I mean, what struck me is that we always try and do everything on a shoestring. That's part of the problem, I think. But how did you decide what to keep and what to ditch off your local offer?
I think sometimes it's about, believe you me, I came into this role from working as a children's services practitioner. I knew nothing about websites. I'm not even of that age group that would know anything about websites. But as a parent and a person that's quite technically challenged, I was the best person to sort of look at it. I believe the term is where you tag everything. And sometimes you can tag everything into everything, and that's when you start going around in circles and bouncing, as I think Clive was saying, bouncing around. So I think what I've tried to do is get, because it depends on what the computer, what do you call it, like the operating program is that you're using. Yeah. That's not the word, but you know what I mean.
Yeah.
And then understanding how that works as well. But I do think that people, I know that there's usually not only one or two people that understand how this is all put together. I think they think there's fairies that put it all together. And it takes a lot of teamwork. I work with the other person that does the whole of the family information service as well. And I do feel that a lot of it is, that's general. We can keep our send local offer bit so much more precise, but with meaningful. I don't think you need to have lots and lots of things that are out of your borough, because we've got Google, and I keep saying, but we're not Google. With a send local offer, it should be local and it should be reflective of what we offer in Wandsworth. Yeah. So that's my thinking behind it. But it is definitely, the other part is promoting what you've got and packaging it well and signposting where people can find it. Yeah,
I'd agree with that completely, Carol. Can I just ask one very quick question? So are you out promoting it on your own, or have you got other people?
I promote it. I am me, yes, and I do the website and I go out and promote the road show. Good thing is I've worked in Wandsworth a long time. I've got a lot of contacts. I also have a team of parent champions that promote our local offer, and we have a card called our wand card, which runs alongside registration, which is an incentive for registering with our disabled children's register. So we are promoting the wand card, putting children onto the DCR, which we then use for feedback, co-production. It gives us a really good mailing list, and parents to tap into when we are going out for feedback and whatever as well. And our parent champions is a volunteer service coordinated by Quorum, and they go out in their localities and they're doing the same things in their schools, their communities, their churches. I definitely, it's a good way to go. Volunteer
Yeah.
schemes are very, very helpful. I don't know if any of the other people here have got parent champions schemes in Send. Particularly, it works well because they're usually parents that have been through that experience themselves. But their role is purely signposting and just getting people to know what is around in the area. It does work well.
Yeah.
Anything that's, you know, any other staff and bodies you can get is great, isn't it? You know.
Yes, absolutely. How do we find out about the Wand card? Sounds good.
Well, I think a lot of boroughs have an incentive card. I know in London they do. It's something that we that was created here about 9 years ago as an incentive for parents, you know, to register their children with the Disabled Children's Register, because then obviously that helps with services and, you know, planning schools and services and whatever. But it's a kind of a, not a loyalty card, but it has certain offers. We're lucky we're in a London, you know, we have big sponsors of like our local leisure centres that provide free swimming. We have some, we have Battersea Park. We're very lucky. We've got a lot of activities there that give us free and kind of reduced prices, things, and local businesses I go around to, and we try and get discounts on different things. So we do very well. And I know there are a lot of different things like that in other areas. I don't know. I know in London they are, because I'm part of a network with that, but I don't know about the rest of the country. And that's good because it provides you a very good, valuable mailing list as well in terms of co-production, and if you want to get people's feedback about your services.
Yeah, sounds great. I've not come across that before, so we'll
I
investigate that. Thanks.
think Lambeth have one called the Liberty card. A lot of places have something called a Max card, but ours is very, very specifically Wandsworth, rather than general offers around the country.
Yeah. One thing we do in Bristol, we've got a team called Flora. Steph, do you want to just? It's a more expensive resource, but it has excellent feedback.
Yeah. I've never met a parent or even it's for parents and professionals, so it stands for families, local offer, resources and advice, and it is just like the in-person local offer, so families, professionals can ring in and say, can you help me with you know, anything really, you know, my son or daughter want to play cricket, where can we go, what's in the local area, and people really love it.
I do that again, as well.
Like financially, I don't know how long, you know, that is going to be financed, or whether it be will survive funding cuts. But I think this is, you know, the other group said we're coming back with similar feedback, and I think we should try and feedback that into our team, Mark, about Flora and about the fact that similar things have worked.
But I do that as well, actually, and you know, I have on my little cards, and there's an email address and there's a telephone number and a really good messaging system. So I think that ties it kind of tight up. But also for us, we have our own local branch of Contact in Wandsworth. So obviously through them, they're obviously signposting everybody. That's something that we commission. So we have our own local branch of Contact. And of course, that's where we refer all our parents to go to. And then, of course, they're also exceptionally good at, you know, signposting to all the other things in the local offer. So I think that the culmination of that, I think, works well in Wandsworth, because we've got that as well.
Sounds good. Thank you, Carol, for all that.
Thank you, but it's lovely hearing what everybody else, you know, has. Yeah. It's quite nice knowing other people have got the same issues as you have as well.
Just very quickly, someone in the previous workshop said that Reading local offer he thought was very good.
I think they just got the local offer of the year award or whatever that is. Yeah, so I think we're all having a look at Reading. But I do think I mean, sometimes you can't control your content, you can't control what your borough is offering, but what you can do is, what you probably can control is how you get that information and how you promote that product that you have got. Obviously, everybody's got different services in different boroughs depending on size. I mean, the gentleman that was saying about how big the area is where he is, you know, it's going to really influence the type of services and the range of services that you have in a very small borough. But it's about packaging it well and promoting it well, isn't it? It's like anything. Yeah, I believe that's what I've learned, because I knew nothing about any of this a couple of years ago.
Sounds like you've been on a steep learning curve and
doing
really well, Carol.
Well, we all do with Send, don't we? Because things change.
Yeah, they definitely do. Brilliant. Thank you for all your input.
Thank you for your lovely presentation as well.
That's pleasure. Joe's telling me we've run out of time, basically. Joe's been very furiously taking notes, I'm sure. So thank you, Joe, for doing that. And we have everybody's address, I think. And I'm saying we, this is the royal we, because it won't be me, but I'm sure it'll be sent to you. And, you know, get in contact with us if you want to about any of thing you've heard this morning, because we're more than happy to talk about it and sort it out together, because, you know, it very much helps to share a problem and find out what other people are doing. So thanks, everybody. Enjoy the rest of the afternoon.
Thank
Take
you.
care.
Thank you.
Bye.
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 Yeah.
Thank you.